On this episode, we find out what's better, heat or ice. Hey Discover Nation, Dr. Jeff here. Apologize, it's been a while since I've been able to do one of these videos. I'm going to get to answer a big question today though that I get all the time from my patients, and it's whether to use heat or ice, whether we have swelling or pain or stiffness in a joint, what's the best? And the answer really is neither. Okay, I'll tell you why I'm not a big fan of either, especially ice. So when we have swelling or an injury that a lot of the time, back in the old days, and old days I mean even up to a year ago, we used to tell people that, not we, but the old kind of common thinking was to use ice to bring the swelling down. And that will relieve pain and it will relieve swelling, but the thing you have to understand is why the body wants you to have pain and why the body wants why there needs to be swelling there. Part of the healing process, if let's say you roll an ankle and you twist an ankle and it swells up, or you've got back pain and you can feel swelling or whatever it is, the reason there's swelling is because your body is actually bringing nutrients, white blood cells, extra blood to the area to clean out toxins and get them back eliminated from the body. Swelling and inflammation is an absolutely necessary and essential part of the healing process. And yes, it does come with pain. You need to feel pain. Pain is one of the reasons your body tells you that there's a problem, and so that you take it easy and don't overdo it. Okay, so again, we treat the symptom like it's a problem, like, oh, swelling's bad or the pain's bad. These are things that your body's doing on purpose to actually help you heal, and healing will become incomplete if you are using ice on something all the time. You'll build scar tissue rather than normal healthy tissue. It's just simply not a good idea. And the recommendations, not even just outside of my own personal beliefs, the recommendations for ice have changed a lot recently because of that. People are starting to understand that you can't interfere with the human body and make it work any better. And so yeah, it sucks to be in pain and it sucks to be swelling, but your body is way smarter than you and it's okay for you to be in pain once in a while, and it's okay for us to have a symptom once in a while. And so we have to let our body heal the right way. Now again, you're maybe watching this video going, yeah, but it hurts a lot. That's fine, but you're sacrificing long-term healing for short-term relief. Just understand that. I'm a little bit more of a bigger fan of heat. Not that I think we should all be running out heating ourselves, but certainly I wouldn't be doing heat on an acute injury or something that is swelling. Your body's got enough inflammation there. It knows what it's doing. Let it work. For people who have chronic arthritis or joint issues, heat can actually bring some more blood flow to an area and starting to loosen things up. And I'm not necessarily against that. The big thing is that after you heat, you better be stinking moving. Okay, you got to move. So if let's say you have a tight low back and you put heat on it to loosen it up, great. But you need to move afterwards. You don't want that extra fluid or the extra blood supply that you just brought to the area by putting extra heat on it to stay and pool there. That needs to be recirculated throughout the body, and that's going to happen with movement. And so if you're doing heat, don't do heat on anything that's swelling. There's enough inflammation there. Let your body do what it is. Chronic arthritis, stiff joints, if you want to put a little heat on it, you can. Just make sure that you're moving afterwards. It's super important. So hopefully this answers some questions for you. We'll see you next time.